Hello, I'm Dr. Shafiq Khan, Director of the Center for Cancer Research and Therapeutic Development at Clark Atlanta University, and I would like to welcome you to the new season of Life Notes. Our former host, Andrea Coleman, is no longer going to be with us for Life Notes due to other endeavors. I would like to introduce you to our new host, Ms. Paulette Payne. I guarantee that this season will be just as, if not more, informative than the past.
I'm Paulette Payne, and I'm your host for Life Notes. Today's cancer focus is prostate cancer, and it accounts for 40% of all cancers diagnosed among African American men, making it the second leading cause of death among this group. It's estimated that 1 in 5 African American men will be diagnosed with the disease in their lifetime. We recently sat down with Dr. James Bennett of Midtown Urology Surgical Center to discuss prostate cancer and its impact on the African American community. We also spoke with Dr. Nikhil Shah of Piedmont Hospital, and he talked with us about prostate cancer, treatments, and other options available to men. Let's listen now to find out what they had to say about risk factors and treatment options. Hello, Dr. Shah. Thank you so much for taking time to speak with us today.
Thank you.
So today's show will be focusing on prostate cancer, and I understand that you're an expert in the field of robotic surgery. What role does robotic surgery play in the treatment of prostate cancer?
Robotic surgery over the last decade has come about to be quite an important role in a treatment choice for a man who's battling localized prostate cancer. My training is actually in urologic oncology, or the cancers affecting the urology system, and so that tends to be the bladder, the kidney, and the prostate. A bulk of my practice does deal with men who have prostate cancer, and using a surgical robot is one of the options that they have. It's a more minimal access, a minimally invasive way of treating prostate cancer, which avoids a lot of blood loss, lots of pain as a result of making big incisions. So smaller incisions allow a man to have a better outcome when treating him for prostate cancer.
And I also understand that there are some additional treatment options, the cryosurgery, as well as the brachytherapy and hormone therapy.
I think it's probably best to just step back for a minute. And when a man comes into this office with the diagnosis of prostate cancer, we walk him and his partner, his spouse, through the diagnosis. So we look at the pathology report from a biopsy. So the way that works is a man gets checks with a PSA test, that's a blood test. And often men at risk are perhaps screened more often. And if there's signs from the screening test that suggest that he's at risk, we'll then proceed with a biopsy. That's where we actually take samples of tissue from the prostate and look at it with the pathologist to evaluate it for the presence of cancer. And if there's cancer in the biopsy specimen, we then move towards talking to him about treatment options. Those treatment options vary, and so it can be confusing for men to decide which way to go. Should they have it removed, which is surgery? Surgery can be in the form of laparoscopic surgery, the traditional open surgery where we make a bigger incision, or it can be with robotic surgery. And so it's that discussion between the patient and his surgeon about which method, in terms of surgical treatment, removal would be the best. For some men, there's a radiation option, which is where we actually avoid surgery. And those men who are candidates for radiation avoid surgery, but they often will have radioactive seeds placed into the prostate, and that's typically combined with a beam therapy. So after the seeds are placed to treat the prostate, there's a beam therapy that's given over the course of several weeks, usually 4 to 5 weeks, and that beam therapy also enhances the seed therapy, where radiation is given to the prostate, but it also covers an area surrounding the prostate in case cells from the prostate have